This is Dr. Diego and Debbie. I'm here at the Allende Center for Regenerative Medicine and Vitality. And today, Dr. Diego and I are going to be discussing vitamins, supplements, and the importance to your health. Welcome, Dr. Allende.
Hi.
So, you have quite an array of supplements and medicine here behind us, and this is really a small sampling because I've seen your supplement vitamin cabinet in the back.
Yeah.
You've got me started on all kinds of good things, and of course I've noticed a difference in my health and vitality since I started with you a few months ago. I am very impressed that you are very on top of things, or as the phlebotomists at the blood lab describe you, meticulous. So now you have the supplements here in your office for sale. Do you necessarily have to be a patient to come in and buy the supplements, or can anyone, or would you just prefer they become a patient, at least for you to run labs on so that you can determine what it is they need?
Because vitamins and nutrition and botanicals and herbs are actually medicines, you probably should come in to be seen as a patient. And I hesitate to say that we would sell any supplements without seeing a patient, or at least knowing the patron or the patient who's coming in to purchase them. Because a lot of medical conditions can be affected by supplementation and minerals you may be taking. So you should have an assessment, and then after that, unless something changes within a year's time, it's probably okay to be reassessed on a yearly basis. But if you've got a lot of medical conditions, for instance, some supplements are blood thinners, right?
Wow.
And so we have a lot of patients with heart conditions and vascular problems or coagulopathies, some type of clotting disorder. And therefore these patients, you should do some investigation with some blood work and make sure that the supplements that we're suggesting are not going to interfere with any medications they may be already taking, or possibly increase a risk of something like a bleed or coagulation disorder. So the answer would be yes, they should be a patient. They should be a patient so they can have an accurate assessment to devise a treatment plan, a nutrition plan. Because even a nutritionist would normally do a blood assessment to at least get an idea what a patient may be taking as form of supplements to begin with, and maybe do some specialized testing to see that they are giving them the correct supplements they're going to benefit the most from.
That's interesting because when I've gone to, other doctors, let's say, and I mean people that I'm currently seeing, for example, say my ophthalmologist, and they ask, what medications are you taking? Of course, we always list those prescription medications, but many people don't realize it's just as important to list the vitamins and supplements that you're taking.
And even over-the-counter medications and supplements, because those have cross-reactivity as well.
Okay. What would you say is the most common vitamin or supplement that you advise your patients take?
So the answer by far is vitamin D.
Okay.
So most people are vitamin D deficient, and people don't really understand the broad spectrum of activities vitamin D has. So we call it vitamin D3, cholecalciferol. Our body converts it eventually to 125 cholecalciferol, and so it's the active form of vitamin D3. This is critically important because this particular vitamin has many roles that it does, from the immune system to vascular issues such as vasodilation of your arteries, signaling nitric oxide production so your vessels can dilate. So it has profound effect on many issues. And if you actually do a literature search, you will see that vitamin D's levels, or D3 levels, are inversely related to all-cause mortality, which means that it doesn't matter what you have, what you die from, you're much less likely to die from anything if you have higher levels of vitamin D3. And currently, right now, the levels are most important, probably about 60 nanograms per milliliter is probably what is the ideal level. And that does change depending where you live in the world, because they may call it millimoles or some other form of measurement. But it's really critically important that we have that checked for all patients, because that is also going to affect your bone mineralization. It has an effect on dementia,
Wow.
risk of cancer, depression, obesity, and that's just to name a few things. I mean, the list is like tenfold. There was a nutrient article that came out like 3 years ago, and it was a meta-analysis. And the list of vitamin D3, the things that it does, is like 3 or 4 pages long that it benefits in. So that's the number one, by hands down. I think there's other ones in it that are critically important as well, but if you're asking me what the most important one, that would be the most important.
Okay, I have another question for you because friends of mine have asked about this. Last time we did blood labs on my thyroid, you noticed that my T4 was off just a little bit. And you asked me what kind of multivitamins you taking, and I thought, oh gosh, in addition to all this stuff, you want me on more? But you put me on a multivitamin. Next time I had the blood labs taken, T4 was normal.
Yeah, so let me give you a little background information on
Okay.
that. Years ago, probably about 40, 50 years ago, in the 1950s, 60s, we had a problem in the Midwest where a lot of the grain was farmed, where there was a high level of iodine in the soil. And so that iodine was harvested out of the foods, and it was eventually people got iodine overload as a result of it. And you saw a lot of goiter problems with patients. People, they had big, enlarged thyroid glands because the thyroid glands were overworking and swelled basically as a result of this overwork and metabolism crisis they were going through. So in our brilliance mentality going back years ago, we decided, let's change that. Let's take the iodine out and let's put bromide in it. And I'm saying that sarcastically because that is obviously not what we should be doing, but we put another basic toxic gas in our nutrients to replace the iodine, which is not a healthy thing for humans because bromide and other neon gases kind of block the ability of your thyroid gland from working. When I look at a patient's thyroid gland and the studies associated with it, I look at several things. First of all, I look at all thyroid antibodies, including thyroglobulin, anti-thyroid peroxidase. These are antibodies that you make against your own thyroid gland and on the thyroid gland cells. And so that's important because you can attack your own thyroid gland and basically burn out the cells where it doesn't have any effective thyroid hormone to release. Although, because it's being crushed or destroyed, but at the same time your lab results may not really show that because the labs are showing, oh, you've got thyroid hormone, but it's being destroyed and made ineffective. So I usually check for a thyroid stimulating hormone and a free T4, a free thyroid auxin hormone, and a free T3, which is really the actual active hormone, and T4 is our storage hormone or reserve hormone. And so you need to activate your thyroid hormone over time. So there's a process that takes place. First of all, to make active thyroid hormone, there's a whole lot of other minerals and vitamins that take place. You need vitamin B1, B2, B3, you need chromium, you need copper, you need growth hormone, you need iron, you need zinc. You need all these minerals to play a role till you make active thyroid hormone. And then that T4 becomes active into T3 by giving it iron, and then eventually that becomes ATP, which is adenosine triphosphate, which is really the cellular energy stuff that we see in our body. Our thyroid hormone, its production is dependent on an enzyme, and that enzyme is 5'-deiodinase enzyme, and it's selenium dependent, which means it needs selenium as a mineral to activate it and be functional, but it also needs iodine. So there's a whole lot of things that go in the process of, and so my job is to figure that out for you, so that you don't have to figure it out for yourself or read some journal article or somebody on TV tells you, hey, you just need some iodine, here's some iodine drops, and drop these into your tongue every day, and you're gonna have a great thyroid production. Well, that's probably the wrong thing to do, because you should have your iodine levels measured, because you can actually figure out an excretion amount of iodine to see if you're actually deficient. So there's ways of doing these testing, but I don't think that people should do that, because usually these products are sold on TV or on the web, and they tell you, oh, you just need 3 drops of this pure iodine product or Lugol's or something like that. Well, that's like, 3 drops may have like 1,500% more of what you probably need. And you have to be careful. Again, we're going to stimulate the thyroid to make way too much thyroid hormone. You're going to become hyperthyroid and then burn it out and become hypothyroid. So the idea is to be in balance, get the right nutrients. If I give you a multivitamin that has iodine, selenium, vitamin B1, 2, 3, you've got chromium, copper, zinc, some iron trace in it. All of a sudden, you've got everything you need to make active thyroid hormone, and that's what you get. And that's the rationale by giving you something like this, because and will let your body use it in the appropriate way it's supposed to. So yeah, the RDA recommendation, that RDA is set up to give you the minimal amount of nutrition so you can avoid disease, but that's not optimized nutrition. There's a broad spectrum to get to optimized nutrition, and I work in that spectrum of broadening out and optimizing your nutrition as best I can, so I get the best performance out of your physically, mentally, everything. So that would require higher levels, but at the same time, you can't say going to 1,500% of daily recommended is a good idea. I think that's stretching, and I think you should probably evaluate every patient independently as opposed to being told online or on some article, this is what you need. I think that's the wrong way of doing it. So that's why I give you what I give you.
It amazed me, and like I say, when I told a friend of mine who's a nurse practitioner that my T4 went from being just off to normal, she's, well, how can a multivitamin do that? So I'm going to give her the answer now.
Well, and let me comment on that. When you go back a few decades, it was common practice at major university medical centers to say that vitamins play no role in medical management of people's conditions. Well, clearly we're wrong. That was clearly a wrong statement and short-sighted. The ability of your body to work, it depends on nutrition, for sure. Okay, bottom line. And so you need to have the right type of minerals and vitamins available. Sometimes you get effects from herbs and botanicals as well to optimize cell nutrition. So you've got to have as much base knowledge as possible, integrate those ideas, and I think you pull pieces from each and you try to optimize some itself, because you're genetically different from me and everybody else. So I may have to tweak it a little bit to fit you. So it's not cookie cutter, it's basically individualized care, and so is nutrition. We can make assumptions that, yeah, you need this for sure, but probably want to do some lab testing to see if I'm hitting it out of the park, and if not, we make adjustments.
Yeah, it's been great. What are some of these things here?
So there's a lot of things here. First, I'll mention my multivitamin. The multivitamin that I pick is from a company called Orthomolecular. The reason I choose them is just I really like their product. I think you can tell the difference between their product and other multivitamins. And I've had dozens in the office. If you do a literature review on MitoCore, this particular product from Orthomolecular formulations, it is one of the best products you can get. It has the minerals, it has the B vitamins, it's got all sorts of botanicals in there, it's got some good stuff. So, and then there's some antioxidants like alpha lipoic acid and acetyl L-carnitine, which is a basically protein enzyme that helps basically metabolize fats for energy. So why not, right?
Sure.
So I like that. I have patients who have heart conditions. So a lot of my patients with heart conditions don't really understand that they have an energy deficiency state of their heart. And that's why their hearts are not optimized. That's why they have what they call as an ejection fraction of, say, 25% versus 45 to 55%. That just means the efficiency at which your heart is able to push out the blood contents. Well, you're going to feel better if you get most of your blood out into your system because it's oxygenated, right? So the idea is that you have to take the right type of supplements to optimize your heart function. And if you've got heart failure, you've had a heart attack, you've got an arrhythmia like an atrial fibrillation or something else, usually these are low energy states of the heart, and most of these patients are on cholesterol medications, blood pressure medications, they're on diabetic medications. All these medications contribute to basically de-energizing the heart because they block things like coenzyme Q10 production because it's on the same cholesterol synthesis pathway. So if you block cholesterol production because it causes heart disease, we tell people, well, then you're also blocking CoQ10, coenzyme Q10. And coenzyme Q10 is a basically electron donor acceptor in the electron transport chain, which means basically that it is essential to create energy. It is essential because at the end you're making adenosine triphosphate, and that is the energy, that's the smallest molecule that we measure energy by. And so that's why you would have CoQ10. So if I have a patient with a heart condition, this Mito feels good because it's got acetyl L-carnitine because the heart likes triglycerides for energy, so it helps transport them into the heart for energy. It's got a pentose sugar called D-ribose, and that is a raw sugar material, but your heart likes it for energy also. So if you've got energy deficient heart, muscle, and cells, you're giving it pure energy, so you give it D-ribose. It's also got malic acid, which is a Krebs cycle intermediate. That just means in the energy production cycle of all your cells, You got an intermediate which feeds direct. It's like giving your car like high octane in the energy cycle or turbo.
Mm-hmm.
So that's why it's good. I put patients on magnesium because usually magnesium deficient. Most of us are like 500 milligrams a day. And if you drink coffee, if you drink alcohol, you're going to be deficient on a whole lot more besides that. But that can explain being fatigued and tired and low energy, because most of the time you're dehydrated and you're mineral deficient because, again, a lot of those medications that you may be taking electrolyte deplete you, which is essential for basically cell function. Fluxes of ions that go in and out of the cell where it creates the cell function and metabolism. So, again, kind of a lot of stuff going on right there, but my supplements are geared specifically for heart conditions, diabetics, every day, optimized health, regenerative care. So, yeah, and I carry a lot of stuff, obviously, but I try to individualize it for each patient because on occasion, I'm gonna have to change something up, and I'm gonna probably see a better response in a certain group of patients because of their clinical conditions that they're suffering from.
That's the first time in a long time that all my levels are where they should be.
And if you feel good, that's
Yeah.
usually your symptoms or how you feel is the most important finding because your labs will follow that.
Mm-hmm.
Labs have a tendency to fall a little bit behind, and then when you see them when they're up front, that means that you're pretty far along in terms of what you're feeling like or deficiency states. And so they kind of correct themselves slowly, but usually you feel better before your labs show the greatest change.
Yeah, it's been interesting, but you're right. It's kind of like driving a car with a clean engine. You know, once you've got all of your levels where they're supposed to be.
Right?
And where can we go from here to even improve more on that?
So, current events, right? Let's talk about current events. Current events right now, the biggest issue right now that we're suffering from basically is this COVID virus infection, that COVID-19, that's been around a year now, and we just can't be able to get rid of it. And we're entering the flu season all at the same time. So people tell me, how do I prevent this? And granted, if you got a lot of medical conditions, you're at risk, you're probably going to get a flu shot, okay, because you want to minimize any comorbidity effect from getting the flu. At the same time, we don't have a COVID-19 vaccine, but what if I told you that there is significant amount of literature support that will show you that, say for instance, your vitamin D3 levels, if I got it up to 60 nanograms per deciliter in your blood, that your absolute risk reduction of getting a virus infection, including COVID or influenza, would be like 50% reduced. The likelihood. What if I told you that N-acetylcysteine, which you call NAC, okay, it's a precursor to the production of glutathione, which is a very strong antioxidant your body uses to basically break up clots in your blood, okay, and help detoxify oxygen-free radicals, which cause all the damage to your DNA and your cells. Why? Because if you don't do that, you age faster and you die faster. So what if I told you could take N-acetylcysteine as a supplement or glutathione, and you could reduce, even if you got the flu, 50% of you wouldn't even know you had it because you would have had no symptoms. What if I told you that? What if I could prove to you, and I could show you the articles that show meta-analysis and literature going back 5 years, or even more current than that, that show that this is possible? So the idea that we're helpless is not true. The idea is that you can mitigate, you can reduce risk, disease, you can reduce symptoms of bad outcomes just by changing nutrition. Why not get the lab analysis, see where you are? Why not start putting the right stuff in your body? So because of current events, I would say vitamin D3 is super important. Okay, let's get N-acetylcysteine for those of us who don't have any coagulation disorders, because it does thin your blood. Now, the caveat to that is that N-acetylcysteine has never been shown to have an adverse effect at super high dosing. I mean like 10 grams intravenous a day. It has shown no side effects for people having strokes or anything like that. So, but it is a blood thinner because it helps break up these little, what they call these linear coagulation, basically, products. So it breaks them up. So if you take something like that on a daily basis, like 600 milligrams twice a day, you took vitamin D3, say 5,000 milligrams a day with vitamin K2.
That's right.
Right? You got to take it with K2 so it puts the calcium in your bone and not in your arteries. And then you took zinc. Why zinc, doc? Because zinc is a RNA replicase enzyme inhibitor. And what does that mean? Well, A lot of viruses use a ribonucleic acid specialized enzyme to help create its DNA reverse. So it reverses and makes its own DNA so it can recreate its particles and infect your other cells. What if I told you zinc can block that enzyme from working? And zinc is one of the most important products in cellular reactions. Between that and magnesium, they do like 300 different metabolic reactions in your body. So if you took 50 milligrams of zinc extra a day, especially if you exercise, because you're always sweating out your minerals, okay, and then you got zinc, you got vitamin D3, you got N-acetylcysteine, vitamin C, because it's a great antioxidant, right? It helps get rid of free radicals as well. Free radicals cause damage to our cells. It ages us. So you need support there. So you take probably 1,000 milligrams twice a day for a daily basis. That's fine. Some patients, they have nephrolithiasis or kidney stones. We may have to look very closely to see it, because sometimes people can get that as a result of ascorbic acid. What we want to do is keep an eye on that, and maybe we would reduce that if they didn't need it. But if you're trying to avoid disease, this is what I'm trying to tell you to do, is avoid disease. And I think the other thing is whether you take glutathione. Glutathione is, like I said previously, is a really strong antioxidant, but you can take it as a supplement separately. And there's no recommended daily allowance for it, but this product, because it's an antioxidant, it can regenerate and help you detoxify things that cause damage to your arteries, things that cause your blood pressure to go up, things that increase coagulation, which means clot formation, which is, kills people, okay? So I think about these things, and if I want to make a difference right now to avoid disease, I want to take those things right now. Those are the things that you got to have in your body.
I take my handful of supplements. I do. It has become a ritual. And I tell myself, you've got to go in, you've got to take those 13 because I don't want to get sick. Right. It puts a crimp in my style. If I've got a trip planned to the coast, I don't want to have to put it off because I got sick. So, and knock on wood, I haven't been sick for
and you can
quite some
recover
time.
quicker. And you can recover quicker from the condition if you have the supplements on board. And these are all, this is actually new. I mean, the research in the literature is not new, but the understanding how to use it in modern day is new, because everything always lags the literature. The putting into practice part, and the, oh no, you don't need that, or let's not worry about that. That's actually more important than anything.
Yeah.
And because our fix is every day is a magic pill, and everybody said, well, these are pills too, doctor. Hey, the way I look at it is that if the soil is stripped of most of its nutrition because it's overgrown, okay, we can make stuff look real pretty and really nice, but it doesn't mean it always has a lot of nutrition in it. So I think that taking the added supplements is critical, because again, you're going to have less health problems moving forward, and we all want to live taking a whole lot less medications that make you fatigued and tired and draw energy from you. So I think the idea of take a supplement where you actually gain energy, feel better, as opposed to taking these supplements to make you feel crummier, but you're actually healthier. Well, perception is everything. I think that, again, if you feel good, you're probably going to live a whole lot longer than if you feel crummy.
And I'm a big believer in quality of life.
Absolutely.
I'm addicted to that bed, because the next day after I tried it, I was thinking, I want to go back now. I don't know, it really was a wonderful feeling, and you have to experience it for yourself to know this.
I agree. I agree with you more. And I didn't know it till I utilized the bed when I was at the convention, I guess a year and a half ago, and I realized, wow, this thing, I really couldn't tell in the very beginning I started, and then about 50 minutes, I'm like, oh man, I was really relaxed, I felt like really good, and I thought, wow. And then, the salesperson was telling me, this is what you're going to feel afterwards. I'm like, I'm feeling that right now.
Yeah.
But I thought I was really sold on it, and you read the literature on it, it was really remarkable how that product works.
Yeah. Oh no, one experience in that bed, and I'm like, I could get addicted to this. Gee, addicted to feeling good. What a concept.
Right.
So, I would love to come back and talk to you some more about food as medicine, nutrition, and I am currently doing a challenge with the person that introduced us, Tracy Tappan. She has a group of us women that we walk Woodward Park on Saturday mornings. Of course, Tracy wants us there at 6:30. It's dark, but anyway, we're all doing the blood type diet. This was something, the book was published in 1996, so I had read it a long time ago, and then after a while kind of forgot about it. But I'm blood type A positive, and I'm supposed to be vegetarian. So we all got copies of the book, and we're trying to follow the book, and it's more difficult for me than I realized because I'm giving up a lot of things that I'm used to eating.
Yeah, it's always tough for anybody because now you're on a diet.
Yeah, you're shifting gears, and you're no longer allowed to eat certain things that you have grown to love. But I'm really trying to experiment, to see what happens.
Yeah.
You know, I think we're doing it for 5 or 6 weeks, and we just completed week 1. At least I did. Completed week 1. But once I'm through with the challenge, first thing I'm going to eat is a steak.
And we'll see how you respond to that because if you'll know.
Yeah, I'll know.
Right? Because if you feel like terrible
Yeah.
and you feel nauseous, you're like, oh, that's probably not for you.
Yeah, that's true. This is a good experiment. So. All right. Well, thank you.
My pleasure.
All right, and we'll see you again soon.
Sounds good.